Welcome back to the MediByte channel. I'm your host, and as a healthcare professional, I'm thrilled you're here today because we're jumping right into a super important topic, cervical insufficiency. You might also hear it called cervical incompetence. Look, if you or someone you love is navigating a pregnancy, understanding this condition is absolutely crucial for feeling empowered on your medical journey. So we're going to break down the science, the subtle symptoms, and the incredibly effective solutions we have available today. Let's get into it. Okay, here's our quick agenda for today's explainer. First, we'll look at understanding the cervix, then dive into the causes and risk factors, recognizing the symptoms, diagnosing the condition, and finally, we'll wrap up with the effective treatment options. Section 1. Understanding the cervix. First up, let's establish a baseline by looking at what a healthy cervix normally does during pregnancy. So, think of a normal cervix as a heavy, locked door at the very bottom of the uterus. Normally, that door stays tightly shut and only opens or dilates when labor officially kicks off in direct response to those powerful, rhythmic uterine contractions. But with an insufficient cervix, the tissues making up that door are just too weak. It actually starts to open up painlessly, entirely without those labor contractions and way before the baby is due. Usually this sneaks up right in the middle of the second trimester. Now, getting a diagnosis like this can feel totally overwhelming. But just look at these numbers. It affects about 1 in every 100 to 2,000 women. To put that into perspective, it means this is a very well-known, highly trackable condition in the medical community. You are absolutely not alone. We know exactly what to look for, and more importantly, we know how to step in and manage it. Section 2, causes and risk factors. Let's figure out why this weakness even happens in the first place. While the exact definitive cause is still a bit of a puzzle to medical science, but we do know it usually involves a mix of structural abnormalities or perhaps past infections. There are some specific red flags that really increase the likelihood of a weak cervix. We're talking about congenital connective tissue disorders like Ehlers-Danlos syndrome, for example, or birth defects where the uterus itself just isn't shaped quite right. And from a diagnostic standpoint, having 2 or more previous miscarriages in the second trimester, that is a major historical risk factor that doctors immediately look out for. Physical injury to the area is another big piece of the puzzle. Maybe the cervix was injured during a complicated past delivery, or it could be weakened from a procedure like a cone biopsy, which is when a larger piece of tissue is removed to test for or treat cervical cancer. But actually, scratch that. I want to be super clear here. Most women with cervical insufficiency don't have any of these underlying conditions or past traumas. Sometimes it just happens, which is exactly why proactive monitoring is so vital.
Section 3. Recognizing the symptoms.
Honestly, this is what makes this condition so incredibly stealthy. Many women experience absolutely zero symptoms until the baby is delivered early. Because it totally lacks the painful contractions of traditional labor that we're all taught to expect, it can easily fly right under the radar. The cervix literally just gives way silently. But if early warning signs do show up, they are super subtle. We're talking vague, painless pressure down in the vagina, maybe some unexpected spotting, a dull ache in your abdomen or lower back, or just a sudden change in vaginal discharge. Paying close attention to these tiny whispers from your body is so critical. If you ever feel these subtle symptoms, trust your gut and contact your healthcare provider right away, just to be safe. Section 4, diagnosing the condition. Let's talk about how doctors actually catch this. Since this condition loves to hide, doctors have to be vigilant. Our absolute go-to tool is transvaginal ultrasonography. By using a handheld imaging wand inserted directly into the vagina, doctors get this brilliant, high-definition, close-up look at the cervical tissues. It literally lets us measure the exact length of the cervix, allowing us to catch any abnormal shortening super early on. It is an absolute game changer for spotting the very first physical signs of trouble. Section 5, effective treatment options. This is the beacon of hope, guys. Here's how we protect the pregnancy. The gold standard for treating this is a procedure called a cervical cerclage. Basically, doctors go in and place strong medical stitches around or right through the cervix to physically stop it from opening up early. Think of it as directly reinforcing that weak door we talked about. Done under general or regional anesthesia, these stitches hold the door securely shut, and they're usually snipped and removed just before the delivery date so the baby can be born normally. So when do we actually do this? Well, the timeline is highly personalized. If a woman has a heartbreaking history of 2 or more second trimester losses, doctors might actually recommend placing the cerclage before she even gets pregnant again, or very early in the first trimester. For other patients, it might be an emergency intervention placed dynamically during the pregnancy if we suddenly spot that shortening on an ultrasound scan. But what if there's no history of pregnancy loss and we just happen to catch a shortened cervix on a scan? There is a really precise, step-by-step playbook doctors use. Step 1, we detect the shortening. Step 2, a thorough doctor evaluation. Step 3, we often bring in vaginal progesterone to help support the pregnancy. Step 4, continuous, rigorous ultrasound monitoring. And finally, Step 5, if there's any history of preterm birth combined with that short cervix, the doctor will likely step in and suggest that cerclage to physically secure the area. Finally, what if preterm labor is suspected later on, like after 22 weeks? That's when we bring in the powerful secondary treatments. We might prescribe corticosteroids, which are amazing because they rapidly speed up the baby's lung development just in case they arrive early. We also use modified bed rest. That basically means staying off your feet for most of the day to physically take the weight and pressure off that weakened cervix. Look, medical science has given us some truly incredible tools to monitor, reinforce, and protect pregnancies affected by cervical insufficiency. Knowing your history and partnering with your medical team is everything. Thank you so much for joining me for this explainer today. I really hope this deep dive gave you some clarity and confidence. Please remember to hit that like button, share this with anyone who might benefit, and subscribe to the MediByte channel for more empowering medical insights. With modern tools like cerclage, premature delivery is absolutely no longer a given, which really makes you wonder, what other incredible medical breakthroughs might soon make cervical insufficiency a worry of the past? Until next time, stay informed and stay healthy.